We talk about managing grief and loss. Role disagreements, again, that there's a problem, and the problem is not the other person, but they each have a problem they need to work on together. And helping them think about the way they think about other people, and can it be more positive. We all might have from childhood ways of thinking about other people that we kind of got from our families that may not be the most effective. So we ask people to examine how they're thinking about other people, and building better communication skills. So we do some active listening in class where they talk to each other, and they can't respond until they've really heard the other person out, and then they try to repeat what the person said in their own words, but make sure they're really listening before they go on. And that can be very helpful to people. And assertiveness is a huge thing. Assertiveness is highly related to depression. The less assertive, the more likely you are to get depressed if you can't stand up for your own needs and tell people what you want from them. So we work hard on helping people do this, and not an aggressive, but just an assertive manner. We help people see, do they try to get their needs met in indirect ways or more direct? So, I'm really tired of washing the dishes. If I said that, I can tell you that is not going to get my husband's butt off of his chair and him doing the dishes that night. But if I said to him, I'm exhausted, I did the dishes the last 3 nights, how about you doing it tonight? I have a much better chance. So a lot of times we think that people who love us should know what we need. That's one of the biggest fallacies. They don't know what you're thinking, and they don't know what you're needing. And so we really try to help people say these things in a more clear way, help them. Boy, the trash can is full, again, is not going to get your son to take it out unless you say to him, could you take the trash out? I need your help. It's heavy. Would you do that tonight? So same thing, making sure that people are assertive with their primary care doctor, saying what they'd really like. So we work hard on helping people learn to be direct in their requests. And, we talk about the right to be assertive. We give them this Bill of Rights. I have the right to let others know my feelings as long as I do it in a way that is respectful of their feelings. I have the right to let others know my thoughts and opinions as long as I do it in a way that is respectful to their thoughts and opinions. I have the right to request that others change their behavior when their behavior affects me. I have the right to accept or reject anything that others say to me. I have the right to decide whether or not I will do what others ask of me. And we really do this in group and ask people to read it and think about it. Oftentimes unassertive folks just have let others tromp on them and their feelings, and it can be, people love this. They really like feeling more assertive and that they have rights. So a wonderful thing about the groups is then we have graduations at the end and give people certificates for having gone through the CBT, and often, you just see people's lives change so dramatically. These are very simple techniques, but they can make a huge difference in people's lives. And I'm going to just give you a quick case example and then turn it over to others to talk as well. I hope that some of you haven't tired of hearing this. I know some people have heard me talk before, and I give the same case because it's so dramatic, and I really want to let you know that you don't, oftentimes when somebody comes in depressed, you feel like they're so overwhelmingly depressed and there's so many obstacles in their lives, you can't imagine how you could help them. And particularly how 12 weeks of this little therapy, what could that possibly do for them? But I've been amazed at watching people really turn around. So we did this project of treatment of depression in poor young women in the Washington, D.C. area, and we were screening in one place we screened was WIC clinics, and one was family planning clinics, and this was a family planning clinic. And we screened this young African-American woman who was 24 years old and had 7 children. 7 children at 24, and she was severely depressed. So we screened her for depression and encouraged her to come to our group. And the first group, I remember I talked to her in the morning. I said, "You're coming?" She says, "Yes, I'm coming." And she didn't show up. She didn't show up for the group. So after the group, I called her and said, I'm just so disappointed. I was really hoping you'd come. I think you could really benefit from this. And she was just not really very open on the phone. And I actually knew that where she lived, the apartment building she lived in, was on my way home. So I said, I just want to talk to you. Can I just drop by and talk to you? So she said, okay. So I came to her door, and she had these 7 children, and she had 3 other children in her house that were her sister's children. And her sister actually answered the door when I knocked on the door. And her sister was a big-time drug abuser, and actually was so stoned that she had been in the bathroom when I knocked that she came to the door with her pants still around her ankles, complete disaster. And I walked in, and there was this just sea of little heads. And so I talked to the woman. I said, I'm just really hoping you'd come to group. I feel like you're really depressed, and we'd like to help you. And I said, what happened? You said you were coming. And she said, well, it was raining this morning. And she looked around. She said, you can imagine an umbrella would never last in this house, and it wouldn't, it would have been destroyed in 2 minutes by all these kids. So I don't have an umbrella, and I got soaked, and I just came back home. So we were really lucky. We had some money in this grant. We said, well, we're going to send somebody to pick you up, and we're going to send babysitters to your house to watch your kids, and will you come? She said yes, and she did. She did come the next few groups. And I really thought that I was in over my head, that there was probably very little I could do for somebody who had 7 kids. And her social support network was this sister who often dropped her 3 kids on her and was a big-time substance abuser and was not very nice to her, and a husband who was verbally hideously abusive. And one of the reasons she had gotten so depressed was that her older children were starting to model after the husband, her older son, and be somewhat abusive to her as well. And I just thought, oh my God, what are we going to do here? This just doesn't seem like something we could help. And I felt terrible, but she came to a couple of groups, and she started saying, she said, I just hate my life. I hate living with this man, but I promised God, I stood before God and said I would be with this guy the rest of my life. And I have to do this. And the other group members said, is that really who you think God is? Do you really, the God that you imagine, this loving, would want you to stay where you're being abused and your children are learning to be abusive? And she came back and she said, I don't think I have to keep this agreement. I think you're right. When I really think about it, the God I believe in would not want me to be in this situation. So then we're thinking, well, how's she going to do this? And so it turns out, that she has, that her grandmother was having nothing to do with her because of this man she was with. But when she told her grandmother she was willing to leave him, her grandmother had the money to set her up for a few months in an apartment and said, if you'll not tell him where you're moving and not give him a key, I will help you out. So she moved into an apartment. And one of the most remarkable things about her was, as her depression started to lift, just realized what a great mother this woman was. She just had, she had great joy in her children, and she came in the group and said, I'm just starting to enjoy my kids again. It's so wonderful. So what is she going to do for a living? Anyone want to guess what this woman did for a living? Childcare. She was great with kids, and so she got a position in a childcare agency where she could bring her younger kids. And her mother also came out of the woodwork and had not been helping her because of the husband, and said, I can pick the older ones up out of school. And we followed this woman. I stay in touch with her for years, and she really completely overcame her depression, moved up in the organization that she was working in child care, and is remarried and is just a very happy woman today. So, these patients, somebody mentioned how important it is to have support for yourself this morning, and it is. It's very depressing to hear where people's lives have gotten, but many, many, many people can make a huge change in their life through CBT. So we're really excited to work with some of you to try to bring some of the ability to do CBT to our communities. Wonder if you two would like to come up now and talk a little bit about your experience doing it here.